Hello everyone, thank you for coming. Welcome to NAHDO's 38th Annual Conference. We will be starting in about 1 minute. Before we begin, we want to cover a few housekeeping items. On your attendee screen, you can enter comments in the chat and questions in the Q&A. We hope you will take advantage of this opportunity to engage with our speakers and attendees. This session is being recorded. We recognize and thank the California Healthcare Foundation for being our Petabyte sponsor. Information about all conference sponsors is available in the sponsor area of the platform. Please take a few minutes to visit each sponsor's booth where you can find information about them and find game tokens. Game tokens are keywords or phrases used in the token hunt game for a chance to win a prize in our daily drawings. Now, let me turn the stage over to Norm Thurston, NAHDO's Executive Director. Norm, the stage is yours.
Oh, thank you, Erica. It's wonderful to be with you all here today for our daily opening session. But as Erica said, my name is Norm Thurston. I'm the Executive Director here at NAHDO, the National Association of Health Data Organizations. Let me just take care of a few important things that we need to cover today. First one is to recognize our sponsors. As you can see on screen, we have a lot of sponsors, and I would love to just mention their names quickly so that we can show our appreciation to them. Our Petabyte sponsor is the California Healthcare Foundation. Terabyte sponsors are Friedman Healthcare, Mathematica, Milliman MedInsight, and OnPoint Health Data. Our Gigabyte sponsors this year are Barry Dunn, Comagine Health, Equitim Technologies, HSRI, Medicasoft, and the Peterson Center on Healthcare. And finally, our Megabyte sponsors, the CareQuest Institute for Oral Health, Mercer, Optum, and the United States Census Bureau. We would also like to recognize our strategic partners. So in addition to being sponsors of our events, the strategic partners participate with NAHDO throughout the year in supporting key activities and initiatives that we have within the organization. Of course, I want to always take an opportunity to get on everyone's calendar our exciting upcoming 4th annual in-person networking meetings. And 4th annual, if you're doing your math correctly, that's because of COVID. So COVID, we put everything on hold, and after COVID, we came up with the idea of having these in-person meetings that are focused on networking. And one of the rules that we have is no PowerPoints. It's all about talking and discussing and working on real-world problems together. So save the date, May 7th to 8th, 2024. We'll be at the Hotel Monteleone in New Orleans, Louisiana. And we hope that you will all join us there. We'll see you then. Now we want to just talk to you a little bit about some of our NAHDO awards. Since 1991, NAHDO has periodically recognized various people who are various organizations who have provided service to the community in terms of data dissemination. This year, we are recognizing the Virginia Department of Health and CIVIC, the Center for Improving Value in Healthcare. They received their awards at the in-person meetings in Boston, Massachusetts. Their full discussion of their projects and their proposals is available for you in the on-demand content. So if you just look to the left of your screen, you will see a link that says on-demand content. Stop by there later. The September on-demand content includes both of their presentations. At this time, I would like to announce NAHDO's 2023 Outstanding Service Award winners. Our award winners this year are Scott Becker, who is a partner at McGuire Woods and the publisher of Becker's Healthcare News, and Linda Green, the Executive Vice President at Friedman Healthcare. Both Scott and Linda have provided exemplary and outstanding service to the health data community. And we'd like to invite Scott and Linda on stage in that order to just give a few remarks. Scott?
This is Scott Becker with Becker's Healthcare. I'm incredibly thankful to the National Association of Health Data Organizations. What a magnificent organization. It's sort of the centerpiece of healthcare. Thank you to Norm Thurston. Thank you to your whole organization for what you do. It's probably nothing more important other than fixing the shortage of physicians and nurses and clinicians and providers than making sure the data and the technology works well for American healthcare. We're looking at a daunting situation over the next decade or so, daunting shortages of providers compared to the amount of people we have in our country, challenging power problems between the payers and the providers, challenges in trying to figure out the right balance between fee-for-service and value-based care. So much to be accomplished. The answers aren't binary. There's lots of answers that are somewhere in between the right answers. We've got to get coverage to all Americans, but even with getting coverage to all Americans, we have to fix access problems and equity problems. There's so much to be done, and health data and technology is right at the center of that. We're incredibly thankful for what the National Association of Health Data Organizations does and for the leadership you take. You've got an incredible organization, and thank you so much for allowing me to just say a few words to your group. Thank you very much. Again, Scott Becker, Becker's Healthcare, thank you very much. And I'm sorry I can't be there with you in person this week.
And now let's hear from Linda.
Good morning, good afternoon, and welcome to NAHDO's 2023 Annual Conference. I'm Linda Green, Executive Vice President, Friedman Healthcare, and I am deeply honored to have been given this award. I'm grateful to be recognized by this community and the NAHDO Board of Directors. I've been involved with NAHDO and the ABCD Council since the mid-2000s. NAHDO and the Council create space for us to share ideas, learn from one another, and think about what's next in health data and how we can help make that happen at home and across the country. We're here because we want to make healthcare better. We do that by giving our decision makers data insights that can change the conversation. This, for me, is the heart of our work. Your work, your everyday work, really matters. These days, whenever I see a new data table or report, I think about what it takes to get those numbers on the page. We're thinking about law, regulation, budget negotiations, staffing, contracting, interagency collaboration, work groups, data security, web design, even site visitor counts. And you are one of the many talented people who make this all happen. We have so much to be proud of. It is such a great honor and pleasure to work with all of you on getting more data and more useful data out there. Thank you for sharing your projects, your excitement, and your commitment with me. Enjoy the conference.
Thank you, Scott and Linda, for your remarks and for your appreciation. We love you. We are appreciative of all that you have done over the many years to support the cause of healthcare data. And by the way, their full citations are available at nahdo.org/awards, and you really ought to take the opportunity to review that and see really what they have done. At this time, it's my privilege to introduce our daily opening plenary panel, Building a Consensus Multi-Source Data Governance Framework to Enable Access and Use of Combined Health and Social Program Data. This session was organized and will be moderated by Jonathan Mathieu of Friedman Healthcare. Jonathan, do you want to join me on the stage?
Hi, thank you, Norm. It's terrific to be here, and thanks to Norm, Charles, NAHDO, the Conference and Program Planning Committee for this opportunity and pulling all of this together to make it happen for us so that we can get together and share information, albeit virtually. I am going to make some brief opening remarks related to integrated data systems, introduce the members of our panel, and then turn it over to them because they've got the most interesting things to say here today. I think we all have an idea of what integrated data systems are, but I wanted to sort of set the foundation or lay the groundwork for what you're about to hear. So an integrated data system, or an IDS, links data from multiple sources, generally at the person and family level, while protecting member privacy and confidentiality. And as we all know from the work that we do every day, protecting privacy and confidentiality of data is of paramount importance. An integrated data system enables appropriate access and use of combined health and social program data to support informed decision-making and policy decisions. And much more on that in the context of two state examples over the next hour or so. Why do we build integrated data systems, or why should states explore this? Because of the value that they create. And specifically, an IDS can contribute to a better understanding of the whole person. And as we think about whole person care, thinking not just about health in isolation or other types of assistance, we really need to pull the data together from multiple health and social programs to facilitate analyses that allow us to better understand the whole person. An integrated data system can help fill current gaps related to social determinants of health, race and ethnicity data, sexual orientation and gender identity, much more on race and ethnicity in the context of the Rhode Island ecosystem in just a few minutes. An integrated data system can help inform opportunities to coordinate essential services to better serve members with the ultimate goal of improving outcomes. And integrated data systems support cross-agency program design and performance evaluation. I mentioned a little bit about the opportunity. I'd also like to highlight some challenges, and you'll hear more from our panelists about how they've addressed those in the context of their particular states. But we find that state agencies are increasingly interested in sharing data to develop coordinated and collaborative approaches to serving the whole person. And in order to do this, access to combined multi-payer claims, Medicaid, human social services, possibly health information exchange and other data sources is required to support creation of integrated analytic and reporting resources. The problem that we all face is that these data sources are often siloed within individual state agencies on different technology platforms. The data fields are non-standard. Oftentimes, documentation is not adequate for linking across data sources. And all of this adds up to challenges in accessing and analyzing the data. And the good news is we can fix this. We can get to integrated data systems that inform decision-making and policy, and we can overcome some of those data governance and technical barriers. And more on this from the states of Delaware and Rhode Island over the next little bit. It can be daunting to think about how to even get started doing these things, but some common sense tips and tricks that you'll hear about over the next hour. One, start by talking to people. Find out how they use data, what their pain points are, what information do they need to be more effective in their jobs. You can learn a lot simply by talking to people, and that's an excellent way to start. Next, identify high priority data sources and reporting needs. By understanding the current state of data sources, data gaps, unmet information needs, and so forth, you can learn a lot about where to prioritize, because you can't do everything at once. You have to start modestly and build over time. 3, engage data owners, stewards, and decision makers. These are the people that control the data and will have concerns about privacy and confidentiality. You need to identify decision makers to serve as champions. You need to create advisory and steering committees to help engage stakeholders in the process and to make sure that people buy into the process and will support it over time. And then fourth and finally, engage experts, creating subgroups with expertise on specific topics to develop policies, procedures, workflows, documentation, and all the types of legal agreements that need to be put in place to support an integrated data system. Those are good ways to think about how to get started. So talk to people, identify your data sources and information needs, engage the data owners and the decision makers, and then finally bring in experts and stakeholders so to help contribute to buy-in for the process and the program. At this point, I'll introduce our panel, and I'll do so in reverse order. Tanya Bernstein, Principal Consultant at Friedman Healthcare, will offer some remarks recorded remarks toward the end of the presentation on data governance considerations and how to fund this kind of work. Rebecca LeBeau, the Director of Data and Analytics at the Rhode Island Executive Office of Health and Human Services, will be our second presenter, and she will talk about the Rhode Island ecosystem, which got started back in 2017 and has been working with some of the challenges of putting together an integrated data system for a number of years. And we'll start out with Alana Berry, the Director of Community and Family Services in the Office of Governor John Carney in the state of Delaware. And let's get right to it. Let's hear Alana's recorded remarks, and we'll have a brief Q&A after each presentation and a final Q&A at the end. So please jot down your questions, share them in the chat, and we'll look forward to answering your questions between each panelist. So,
hi, my name is Alana Berry, and I am the Director of Community and Family Services for the Governor's Office in Delaware. In that role, I lead the Governor's Family Services Cabinet Council, which is where our integrated data system and work is housed. So today I'm going to talk a little bit about Delaware's story around establishing an integrated data system and why that work is housed under the Family Services Cabinet Council. So first, what is the Family Services Cabinet Council? It is an interagency council established by an executive order, Executive Order 9. It was one of the governor's first executive orders. And its council is designed to really problem solve and barrier bust for some of our state's biggest challenges. And so what do those challenges look like? You'll see here, these are the items listed in the executive order indicators. We're charged with thinking about and trying to solve for big issues like thinking about the connection between our schools and criminal justice system, affordable housing, substance use and treatment, violence in our neighborhoods. And because these topics are so big and meaty and intertwined, it really requires perspectives from multiple agencies. So who sits on the Family Services Cabinet Council? You'll see here on this slide, it was really designed to be an executive level think tank around some of these big issues. The governor himself chairs the council with the lieutenant governor and several of our other, what I would call social service facing agencies. These are agencies that often have direct contact with the constituents who are in need of the kinds of services that we design programming around. So why an integrated data system? The simple answer is it's because it's hard to try to reduce violence in our neighborhoods without understanding data around specific instances of violence, whether it's person-to-person or domestic partner violence, whether their individuals are identified as group involved or not group involved, how those individuals experience the K-12 system and how that might have impacted their relationship to violence in their communities, how those individuals are or are not accessing public services across the state. And so that really requires an integrated data perspective. And so that's the whole reason why we house this work around our integrated data system under the Family Services Cabinet Council here in Delaware. Ultimately, this is about cost reduction and improved services for our constituents across the state. So we've done a lot of work over the past several years. Again, this really started with in 2015, the CDC released a report around gun violence, and our city of Wilmington, was titled Murder Capital USA, right? And so there was a need for us to really address some of these systemic issues, and we needed data in order to enhance that work. So some of the main barriers that came up when we started to talk about an integrated data system in our state, legal, obviously. It is important that we de-identify information of specific constituents, even if we need to match their K-12 data, with their health and social services data, with their, public record, right? Those who are viewing the data can't know who that person is or what their name is. And so we've designed a system that really can take individual agency data, whether that's provided by our Department of Safety and Homeland Security or our Department of Education, and can scrub that data and de-identify it down to a unified person ID. And then from that point, as there are specific data use cases or requests, we then integrate the data. So what's interesting about this approach is that we're actually creating agency-specific data systems and dashboards so that agencies can make use of their own data in a more secure, easy-to-use system. But then when there are specific data requests that require integrated data, it also becomes easier to integrate that data in the long run. So when we think about things like, how is the state doing around food insecurity? Are there specific zones across the state or food deserts across the state that we need to think about, right? That requires overlaying data from multiple agencies. And this system, our integrated data system, will make that work a lot easier, and also will de-identify specific persons. So in the future, we could even match third grade reading data over top of or overlay it over top of food deserts in our state and see if there's a correlation. And that's the real benefit of an integrated data system and why we've connected it to the work of the Family Services Cabinet Council. So here in this green box, you'll see some examples of use cases that are currently underway around third grade reading, around opioid mortality, et cetera. But this is really how the system itself works and feeds into one another. It's important to recognize that we have a lot of public data, both federally, locally, et cetera. It exists. We've even done a better job as a state of building public data availability really throughout COVID across the state. But this system, this integrated data system, as it's housed under the Family Services Cabinet Council, is actually designed for executive leadership use, right? For agency specific use. And so it's around securing data, it's around evaluating programs, creating benchmarks and metrics, but it's not currently in this iteration for public consumption. And so this is really designed for cabinet members to be able to answer specific questions that might inform policy or budgetary decisions. So we've learned a lot. We've been doing this work for over 3 years now. That the one piece is that this requires a lot of change management, internal mindset shifts. We've had a lot of challenges with cabinet members, saying yes, and then when we go in and start to do the work and meet with agency leads, people are confused about what this is and what we're doing. And so we've invested a lot in creating a kind of change management, internal communications strategy to bring everybody from your frontline worker to your cabinet secretary on board and understanding the value of an integrated data system. We also realized we started this work and didn't have funding, even though the governor was really excited about it. It was backed through his own private counsel. We needed funding. And again, this is interagency work. So there really isn't necessarily a particular lead agency. And so over the last year, we've actually been able to secure in partnership with our Department of Health and Social Services and their Medicaid and Medicare office an opportunity to apply for a ISP grant, which is through the CMS system. It allows for a 90-10 grant. So we were awarded this grant and we're excited about it. So for the next 2 fiscal years, 90% of our budget for our data system will be supported through the AISP grant and with a 10% match from the state. But really, the other piece is around data protection. As we really begin to dig in and learn from our agencies, we realized that everyone had kind of different rules and standards around how they were data sharing. A lot of this was related to what kind of data it was. Is it federal data, related data? Is it local? Is it law enforcement, et cetera? But really an integrated data system provides some really clear parameters and metrics around data protection for everybody, that allows agencies the flexibility to utilize the data for the programs that they need to utilize it for, but also protects the state and our individual users, our constituents, in ensuring that their data is safe and protected. So I'm excited to hear questions from you all in today's session. If you have more specific individualized questions, also happy to chat with you one-on-one. My contact information is here, as well as the contact information of our data and program analysts in the office. So thank you so much, and I look forward to the discussion.
Thank you, Alana, for that presentation, and also for sharing your insights and being with us today. The first question I see is from Norm Thurston. He said, how easy is it for cabinet members to wrap their mind around what you're trying to accomplish?
It hasn't been an easy task. It's taken a lot of one-on-one conversations with cabinet members and their agency leadership. It's really required the backing of the governor himself saying, like, I care about this and we need to figure out how to make this work. And it also hasn't been easy through cabinet member transitions. I'm working in an office with a 2-term governor who has a year left. And so there's been a lot of transitions over the time he's been in office. And so every time there is a new cabinet member or something like that, it's almost like starting over. But I will say the things that have been most helpful for us is ensuring that we have really good documentation. Our team that's been working on lifting up this project has done a fantastic job of making sure that we've gotten everything recorded, that conversations and questions and discussion points are all, in a spreadsheet, so that when a new person comes in or if a cabinet secretary has questions, we can link to that information and really share what we've talked about and why it matters.
Great. And quick follow-up, how have you organized that information? I think that's a big challenge for people pursuing these kinds of programs. There's just so much. Where do you start, or how do you organize the information, or what have you found that resonates the most when there's a cabinet transition or something like that?
Yeah, so I think one of the ways that it's been helpful in organizing the information is that it's a initiative of our Family Services Cabinet Council, or Kids Council, and other states may call it. That alone has has created its own mechanism for organization and meeting minutes and all of these pieces. And this is a project that we give regular updates on in our monthly meeting cycle. So they're hearing it in that space with the governor and his questions. And then we've kind of developed a process for agency engagement. It starts with like a kickoff buy-in conversation with agency leadership and their, deputy secretaries, et cetera. Then it goes to the more technical side of things where we're meeting with IT managers and that department. And then we tend to bring in policy leads with the IT managers, because conceptually sometimes having the policy perspective is helpful for the IT managers who were mostly thinking about the technical side of things. And then all of that is documented. So like we've got process documents. We have specific slide sets for the different pieces of the model that we're in, whether it's the kickoff conversation or the IT conversation, et cetera. And then we've done a really good job of legally documenting this. So one of the first conversations at the beginning was with our agency legal teams, we crafted an MOU that all of the agencies that sit on the Family Services Cabinet Council had to sign, that really outlays what we're doing and why it matters. And so that also helps when we're having some of the conversations below the executive leadership level to know that like there's a signed agreement in hand and like everybody's bought into the process.
And these are standardized agreements, I take it, and legal
Yes.
counsel has weighed in. Wonderful. That's a common theme, and it's so important, not just integrated data systems, but other things. Mark Stowe asks, how much effort was it to get the AISP grant?
Yeah, so we actually worked with a consultant. Our friends at Friedman were really helpful in helping us think about how to structure the grant itself. What's interesting is we structured it again under our Department of Health and Social Services, specifically the Medicaid office, because when we're looking at some of the topics that you saw related to the Family Services Cabinet Council, either most of the population that we're interested in supporting are probably Medicaid eligible or Medicare eligible. And then there's a small subset that isn't, which technically allows us 100% of the Delaware population to think about. And so understanding that structure was really important in framing the grant itself. But the process was fairly straightforward as it would be with any other federal grant process available.
And that was for the Medicaid match funding or the seed money that you received from AISP?
The Medicaid match funding.
Right. And could you say a little bit more about the AISP support? If I recall correctly, that was early in your process?
Yeah, so that actually came from our was written through our Department of Technology and Information, and that, to your point, served as our seed funding. In order to establish the integrated data system, we needed technicians, right, to actually build the system itself. We needed to, process contracts and MOUs with all of the subsystems we were using. So we utilized things like Snowflake and Power BI, right, to actually create the system. And so that seed funding allowed us to procure those contracts, hire the staff to actually build the system itself. And again, that grant process was, fairly simple in terms of submitting the application, and we were approved fairly quickly. But that is really what got the momentum going and got some agency interest, which allowed us to get the CMS grant, because actually the Office of Medicaid came to us and said, hey, we have this idea. Do you think this is something that you'd want to explore?
Great. I think you covered the second part of Mark's question, which was, can you summarize the reporting requirements or amount of effort? And it sounds like it was a relatively user-friendly process.
Mm-hmm.
Great. We have a question from Erica Lynn Plant. Apologies if I'm mispronouncing that. Did you develop communication strategies for the broader public as well, regardless of whether or not the public is aware?
Yeah, that's a great question. So I would say we're not quite at that phase yet, but it's work that we've targeted that we'll need to think about in the future. The interesting structure about our Family Services Cabinet Council is that it sits as a private council of the governor. So a lot of the work that happens there isn't necessarily public, work. The programs that that come out of that work are public. So as we finalize the system and get it up and running with some use cases and proof points, we will continue to share the story more publicly with constituents and share some of the data that we've learned, that have come through the use cases with the public as well.
Great. And the second part of Erica Lynn's question, data privacy definitely becoming more of a concern for the public. Many are not in industry, so that may require a different strategy. Yeah, different messages for different audiences. And it sounds like you've been thinking a lot about that.
Yeah, to touch briefly on the data privacy piece. I think for me, one of my ahas in this process, and I don't come to this work from the tech side of things. I come from the social services side of things. Was that agencies have been integrating data forever, right? For a long time, because that's how we've been able to answer questions. But the process to do that is really hard and complicated and takes a long time. And often the data is 5 years lagged or 3 years lagged because of how long it took with the legal agreements and et cetera. And then, it's a bit of, at least in Delaware, has been a bit of an antiquated system where like, I'm going to email you an Excel document that's protected. And, because of the data use agreement you've signed, we're trusting you're going to follow all of those policies. The integrated data system actually houses all the data itself, so the protections are built into the system on its own, and then we release through like a user sign in the ability for someone to view the data. So no one's actually downloading it, housing it in their own systems. There aren't necessarily contractors or consultants housing our data anymore. So it's a much safer system. And for me, outside of just like the ability to be able to integrate data with ease, that felt really important given it, 2023 and how, many instances of data privacy and protection challenges are arising, for everyone in this world.
Those are such important points, and thank you for making them. And I think it's a really important part of trying to help people see the value of an integrated data system. The data is brought together, de-identified, linked using a common identifier, and it's a whole lot more secure, private, and confidential than a lot of individual data sets living in lots of different places would be. Elizabeth Davidson had one more question. What are their primary concerns? I think this goes back to policymakers and the representatives of government entities with whom you work. And I think you've done a nice job of covering that. So please, thank you. Well, thank you for answering the questions thus far. Please stay around if you can. We'll have a final wrap-up Q&A at the end of the last two presentations. But thank you so much, Ilana.
Thank you.
And with that, I'll ask Charles to tee up the recording from Rebecca LeBeau, Director of Data and Analytics at the Rhode Island Executive Office of Health and Human Services.
I am Rebecca LeBeau. I am the Director of Data and Analytics at the Rhode Island Executive Office of Health and Human Services. Today, I'm going to talk a bit about our data ecosystem, which is cross-agency integrated data, and using data and analytics to inform and drive effective public policy. Essentially, by integrating data systems, we're able to have a more holistic view on overall well-being. We aim to honor the complexity and connectedness of people in our data set by pursuing projects that will improve the well-being of all Rhode Islanders, and also that are critical priorities to the governor's office. Importantly, while data are linked through individual identifiers, all ecosystem projects, including internal projects, utilize de-identified data sets. Let's dive into the ecosystem a bit. It is made up of 7 state agencies' data and 3 external organizations, which essentially makes up 23 different data sets and hundreds of tables. One of those tables is a central race and ethnicity table that collates the best available information from all of our data sources. Once our data are linked, data is then de-identified to prevent re-identification of individuals. The identifying information is replaced with a unique identifier that we call an eco-ID. The value of integrating data is to help us to provide better understanding of the whole person at their various service touchpoints. It helps us to fill in gaps across data sets and to focus a bit more on social determinants of health across our data sets as well. And it enables comprehensive performance analytics and program evaluation across state agencies. I'd like to touch briefly on the central demographics table. This was created to help to increase the state's data on social determinants of health, as well as ensuring equal access across Rhode Islanders. At a high level, this project took semi or mostly incomplete race and ethnicity data across all of our sources and developed a table with the most recent self-reported data at the person level. We knew that we needed to ensure that the process of integrating these data sets had to include privacy, autonomy, and consent of those represented in the data. Ultimately, the table was meant to be used for any and all data requests coming through the ecosystem. The ecosystem began as a proof of concept pilot, essentially taking a look at some of the questions and ideas across state agencies, pulling those agencies' data together and creating integrated data sets that informed the governor's office or the secretariat of really high-level, specific, interesting programs at the time. Here are a few examples on the slide. Essentially, the state in 2017 identified siloed data as an obstacle to the ability to view people in full, all of their state touch points and the impact that that has on services and programs. I'm going to jump ahead quite a bit. We're going to miss a lot of months in between. But here's where we stand today. We've implemented some changes in the past year and a half or so. And one of those was expanding the analytic capacity and blending our ecosystem team with our Medicaid team. Today, we have 155 projects in motion, 29 of which are ad hoc, 54 ongoing, and 72 larger projects. Some examples of use cases are also here on the slide. We've also changed things in terms of data requests coming in. We've implemented a change that requires state agency priorities to be part of the data request. This allows us to pull our focus inward and focus on what the needs are for the state at a high level and an individual agency level. In doing this, we were able to also build in ways that we could much more quickly and easily share data across the agencies under our secretariat. So that includes Medicaid, Rhode Island Department of Health and Human Services, Department of Behavioral Health, Developmental Disabilities, and hospitals. These changes together have increased the demand for the ecosystem. The team in the ecosystem went from having 18 projects in 2020 that made up a combination of external requests and internal to 210 projects, the majority of which are state priority projects now in 2023. We continue to make enhancements to the ecosystem and improve. We have been improving our data on sexual orientation and gender identity data by standardizing the ways it is captured and utilized. We are continuously improving and streamlining our data request system, our system of reviewing and approving processes. We continue to integrate new data sources. Some examples are Veterans Administration, Department of Motor Vehicles, State Police, and new sources from agencies we've been working with already over the past few years. An example would be collecting professional licensure data from RIDO. So why build an integrated data system? And how do you prove the importance of having one? Well, first, it's you want to have a use case, something that's compelling, that solves a problem that people really care about. I'm guessing most folks here, even listening to this, already have ideas of what that looks like. You want to identify champions, people who are able to step up and really support these projects and are able to help fight through some of the barriers you're going to encounter. Trust and patience are really critical from the very beginning of this. You want to develop consensus policies to build trust with our data owners, set the rules together, really and truly collaborate on each of these, ensuring that data stewards and subject matter experts are comfortable with the analyses before anything is shared. Data governance, we have data stewards and community advisors that are part of the team from the very beginning, and they work with us through each stage of the analytic process. We have an executive board, a data stewards group that meets monthly, project advisors, and ecosystem team members that are all essential to our governance process and participate at each level. And then finally, resources. We needed some funding, and that's usually required, so that we could have time to build in this proof of concept, and then also to start to build on what we need for our data structure going forward. We were able to get a Medicaid match that allowed us to do this back in 2017, and we've utilized that to build on what we have today and to continue to build on it as new technologies come up and we need to expand our technological and analytic teams. I hope this was helpful, and I look forward to getting to the phase where we get to answer some questions for everyone. Thanks so much for listening.
Thank you, Rebecca. That was a terrific presentation, and thank you so much. You've been involved with this throughout the entirety of the journey, is that right, since 2017?
It is in a different position, but yes, I was here when it all started.
Terrific. I liked your comments about shifting the focus to internal high priority requests, that is, requests that involve multiple state agencies or are high on the list of an individual state agency. Are there plans to also take requests from external entities at some point, or is that too speculative at this point?
No, that is the plan. We've always wanted to be able to share the data outwardly as well. I think what happened for us is it just became too big of a part of what we were doing. People get really excited. My background is in research, so I understand. People get really excited. They know this data is there. They want to access it. And so, we get a lot of requests that way. But we really needed to focus on the needs of the state before doing that again. So I'm hoping that over the next 2 years or so, we'll be able to open it up and be able to take external requests as well.
Great, thank you. Elizabeth Davidson asks, you mentioned privacy, autonomy, consent as data governance goals. What does this mean for the individuals whose data are integrated? Is or are there opt-in or opt-out features?
Depending on the data set, there are. So there are some data sets that require consent for us to even pull it into the system and or use it in reporting. Others, that is not the case. So for example, some of the larger data sets that are collected based on, I'll give an example, overall Medicaid claims. Those data are automatically part of the system, but de-identified. Other smaller data sets will be monitored in a different way.
Great. And can you talk a little bit about how the data comes together and is linked and de-identified? This is a pretty savvy audience, but not too weedy, probably.
So essentially what we do is we have an algorithm that we use for matching. So when a new data set is going to be integrated into the system, we have the sort of top 5 matching metrics that you can use. And if you can get at least 3 of those, we can do a pretty good job of it. But, it's Medicaid ID or individual ID, name, Social Security when possible. That is not always possible, and date of birth. So we take that into the system and only our technical team sees that. So I don't even see that. Our technical team uses that. They use this matching algorithm and they match as best as they can. And when it's matchable, they get into the system with an eco ID. So part of that process, though, I think, which is important to mention, is that we check that annually to make sure that is still working the way we believe it's working and that our match is still pretty high. We have a really low rate of what I'll call mismatch to sort of push this along a little bit more quickly. But we are always checking it to make sure that we're doing the best that we can to get the closest match and the highest match level.
And users of the ecosystem have access to no PHI, limited identifiers,
No PII at all. I'm always leery about saying PHI because we're a health and human service organization. So they get some health information, but they can't go back to the individual and figure out who they were. And that's really critical for Rhode Island, by the way. I know people probably don't have to think about this. Rhode Island is very small. So we have a committee that tracks everything. If questions come up where, it's a special population, or we believe that you could somehow end up being able to identify the people at the end, even with no PII, we won't put that information out.
Great. And I imagine that contributed significantly to buy-in amongst the participating agencies, among other features of the program.
Right.
Margaret Dennis asks, could you give examples of upcoming high priority projects? Maybe talk about a couple of use cases that have really resonated with you.
Sure. The one that comes to mind always and immediately is the overdose crisis. That requires a lot of integrated data to actually get a full picture. And it's also one that has a lot of federal regulations, a lot of law that surrounds it. So it's been one of the more difficult to integrate as much data as I believe that we need to understand the gaps in care and places that we could have jumped in sooner. So that's a big one that we work on pretty often. Another would be, here's another one that I think will resonate, the PHE unwinding. So as the federal government declared COVID over in March, that requires a really big lift across our agencies to ensure that we're not just dropping people off of coverage and that we're helping them to continue on other coverage as needed. So that requires integration from 3 or more different data sets to allow us to ensure that we are covering everyone appropriately going forward.
Terrific. Thank you for sharing those examples. One more question came in from Sylvia Hobbs. When the technical team sees the data, they are matching encrypted data, right? Is that correct?
So they are matching, yes, data comes in encrypted. Yes, that is correct. So what the process that we have is every time data is transferred anywhere, even coming into us, it's encrypted. And we use particular methods for ensuring that there's less chance of anybody being able to come in and attack it or any chance of breach.
Great, thank you. And last minute question, do you include APCD data in your ecosystem?
So our APCD data is housed in the ecosystem, but is de-identified. So we cannot match it back to the rest of our data. So there's no pulling it in for comparison, but it does live in the ecosystem currently.
Great, thank you. And moderator's prerogative, could you say a little bit more about the race and ethnicity work and the benefits of bringing together that information from multiple sources? This audience is very familiar with the limitations of race and ethnicity data in hospital discharge sources and APCDs. And if you could just tout the benefits of that a little bit more, that'd be great.
So critical. It's so critical. So again, I come from a research background, and when I saw how, frankly, terrible the state race and ethnicity data is and continues to be currently, it was shocking to me. It's really hard to talk about things like social determinants of health when you're not collecting the data that you need at a base level to do that. So what we ended up doing is going to all of the different data steward partners that we work with and looking at how they collect that data. And, going with a hierarchy. So who collects self-identified data? Who has the most input? So COVID was a really important party for us because as people were coming in to get tested for COVID, we were getting self-identified race and ethnicity data. So that was sort of our starting point, and we were able to pull that in. We doubled our race and ethnicity data doing that. And with the data stewards understanding the need for that and how important it was for all of the priority projects and other projects going forward, we have an MOU that allows us to share that across all projects and data requests that come in through the ecosystem. I would still like to collect better data. I'm going to put that plug in. I think, it's time for states to really consider how we're getting that data and collecting it better and why we need that data, right? There's an education needed for why that's important. And we have not done that, but that needs to happen.
Thank you so much, Rebecca. We need to move on to Tanya's portion of the program, but I hope you'll stay with us until the end. We'll do some final Q&A, but thank you so much for your presentation and sharing your insights and responses to these questions. And with that, Charles, would you please pull up our last presenter?
Hi, everyone. My name is Tanya Bernstein. I'm a principal consultant at Friedman Healthcare, and I am excited to take you through these next few slides. So, governance considerations and funding. Here are some of our lessons learned from supporting numerous states in designing and standing up their integrated data systems. So first, data governance encompasses the people and processes that will be used for documenting, controlling, and standardizing the data. Focus more on the principles that will guide these decisions, as opposed to the technical tools that will be used. So for example, focus on the framework that needs to be in place to guide data quality, permissions, and data sharing documentation, the development of data dictionaries with definitions for all of your derived data elements, as well as the documentation of the native systems from which data will be sourced. Data governance development initially relies on these processes and people, and less on the technical tools. Technical tools can be effective, but only if complete and up-to-date documentation is already in place. Second, start small, go slow, but to go fast. So in several states, it wasn't until we had a very specific use case that we identified that the integrated data system really got the buy-in necessary to get started. A high stakes, high priority use case or question allows people to feel engaged and importantly provides a compelling reason why you need to integrate specific data sets. All of a sudden, there's a tangible use case that ideally people care deeply about and are willing to share their data to help address. We no longer need to speak in hypotheticals. Let these 1 or 2 use cases serve as your pilot so that you can practice your data governance processes and so that everyone contributing their data can feel comfortable. 3, develop standard templates and forms for every aspect of data governance. So data sharing agreements, data dictionaries, a data request form, data issues logs, data access logs. Use these templates to support and enforce your agreed upon protocols and processes. Don't let the perfect be the enemy of the good. The documents will invariably need to be refined over time to make them more efficient and more responsive. More on this on a coming slide I have. And finally, early and consistent stakeholder engagement. In our experience, data sharing only goes as far as trust. To develop an effective and sustainable data governance structure, we believe it is crucial to identify key stakeholders early and to engage them in every step of the process. This involves identifying at least one individual that can represent each data source and making sure they're involved in every step along the way. So let's move to the next slide, actually more on the essential roles. So this slide identifies some of those common categories of stakeholders using the framework that we employed for the Rhode Island ecosystem. So first you can see the executive board. This is also known as executive leadership. These are the heads of the contributing state agencies, those that are contributing their data. These individuals will help you articulate and promote an overall project vision and serve as the champions for your integrated data system. Next comes data owners or data stewards. These are the individuals that represent each data source and review all the requests for data that require the use of those particular sources. In this way, your data owners or data stewards will monitor data use, data access and release, and ensure that each contributing data source feels good and comfortable with your data governance processes. Next, we have project advisors. These are your subject matter experts who will provide ongoing input on technical, policy, and other issues throughout your program scoping, development, and implementation, as well as your ongoing operations. And then finally is your day-to-day project team that will identify questions for the other roles to weigh in on and make sure that all of the agreed on processes and protocols are being followed. These are your day-to-day implementers. So next are those standard templates and documents. Here you can see the 4 documents that govern the Rhode Island data ecosystem processes. These documents were mutually agreed upon by our legal counsel, representing, actually it was the legal counsel representing all of the contributing data sources. And we also worked with the Actionable Intelligence for Social Policy group over at the University of Pennsylvania and pulling these together. So you can see at the top here, we have what we call an IMOU. It is our Interagency Memorandum of Understanding. It articulates the vision and mission and the process that will govern all of the ecosystem data sharing and use. Next, we have the data sharing agreement. It's a 2-party agreement. It is signed by each data provider, and in this case, the Executive Office of Health and Human Services, which maintains the ecosystem. So we have a single data sharing agreement from each agency that contributes data to the ecosystem. Next, we have, now it's called a data request form. It used to be called a data license request. That's why you see that discrepancy between the narrative and the visual here, but it's really our application for data. So this includes who the requester is, what agency they work for, what organization they represent, their intended use of the data, the methodology they will follow, as well as their credentials to ensure that they will be a responsible steward of the data. That data request will be reviewed by all data stewards that represent a data source whose data is being requested as part of the data request form. And then finally, we have a data use license. This is also your DUA, your data use agreement. So once a data request form gets approved by all data stewards, we have a data use license that we ask the requester to complete, and it is a multi-party agreement between the recipient as well as EOHHS. And this governs appropriate use of the data, the rules on how it should be disposed of once the project is completed. Also re-articulates the rules around sharing any intended publications, redisclosures, things like that. And then finally, one of our biggest lessons learned about integrated data systems is related to funding. So one of the most viable funding opportunities for integrated data systems is known as Medicaid Match. And I'm sure that some of the people in this audience will know quite a bit about Medicaid Match, so I'll keep it short. But CMS Medicaid Match, formerly called Medicaid Federal Financial Participation, or FFP. So all states that operate their Medicaid programs within federal guidelines are entitled to federal reimbursement for a share of their total program costs. The federal share for Medicaid administrative activities is known as administrative match. It's generally around 50%. So if that covers anything found to be necessary for the administration of the state Medicaid plan. However, in some instances, CMS provides a higher matching rate for select services or programs or projects. So for example, Medicaid expansion or upgrades to Medicaid computer and claims processing systems are eligible for an enhanced match rate. That is known as enhanced match. Under the enhanced match rate, activities and programs can be matched at 90% by CMS while they are being developed and designed and implemented, and then 75% once they're in what we call an M&O phase, or maintenance and operations. So in other words, for every dollar that something costs, CMS will pay 90 cents towards it while it is being designed and developed, and the state is only responsible for coming up with the remaining 10 cents. So in the past 5 years or so, many states have successfully received Medicaid Match for their all-payer claims databases. And more we are seeing states apply for this enhanced funding to support their integrated data systems as a natural evolution of a state's data sharing and integration efforts. In fact, since 2019, CMS has made it clear that they are very interested in data sharing and data interoperability and data integration projects. In January of 2021, for example, there was a state Medicaid director's letter that was published that reiterated the availability of enhanced match for developing Medicaid resources to support data integration and data sharing, especially that which can assist in identifying social determinants of health or providing more complete SDOH data. So this enhanced FFP funding for integrated data systems has been leveraged now by several states, including Delaware, for their DIDS program. So hopefully that is encouraging news to everyone. Questions?
Terrific. I will thank Tanya virtually because she wasn't able to join us for the Q&A session. It looks like we've got about 5 minutes left in this session, and I'd like to go back and make sure that we address 2 other questions. Sylvia Hobbs asked, in order to maintain the data system, and this was in response to Alana's presentation, in order to maintain the data system and its technical contract staffing after you received a grant, was there an expectation on the part of the legislature that you would continue to maintain the system through grant funding with or without jeopardizing or reducing your state funding? So maybe talk a little bit about the role of the legislature and state funding in supporting the DIDS work.
Yes, that's a great question. So I would first just answer it and say, I don't think there was any sort of expectation, right? The DIDS work is a state funded project that shows up in the general budget. So the legislature, the governor in Delaware, makes recommendations for his recommended budget, his or her recommended budget. And then the legislature at the end of the legislative session, which is in June in Delaware, has to approve that budget. And so from that vantage point, right, we go through budget hearings, and if there are any questions or comments, et cetera, we would work through those in that process, which in Delaware typically happens in February for the timeline of approval in June. But in general, I would say there are lots of state-funded projects who are awarded grants, and that either allows for expansion or a ramp up of a project. And when the grant ends, may revert back to state funding. And so that may require shifts in personnel or shifts in the amount of work being done. But the expectation is that the state would continue this work long term.
Great, thank you. So there is some general fund support, but that one doesn't want to rely on that too much.
Exactly.
Rebecca, can you make a few remarks about state general fund support for the work that you're doing with the ecosystem?
Sure. The ecosystem is really quite enormous at this point and covers much of our reporting. So it is critical for us to keep moving. So we do have support on the general revenue side, but it is the hope of the state that we can continue to get some contribution to assist us in doing this. And we can do this in different ways. Some of the things we've done in the past is we are able to charge for APCD research projects. So sometimes we can get some money to help bolster what we need to keep the ecosystem up to date in terms of technology and everything, and fully resourced with everyone we need.
Great, thank you. And Susan Hernandez asked, does your secure system have a way to analyze the data, SQL, RStudio, other analytic tools? And I suspect the answer to that is yes, but Rebecca?
Yes, we have specific software in place that we use. It actually does also go through yet another space that blocks anybody else from getting in. So it's a little bit cumbersome because you have to go through 2 systems to get to the data. But yes, we directly go in and we can use SQL. We mostly use SQL to do our analytics.
Alana, or is DIDS at that point yet? Or could you share a little bit about where you are with that?
Yeah, so the state utilizes Power BI to do some of our system analytics, and that's built into the DID system that we've established.
Great, thank you. We have 1 minute to go in this session. I want to thank both of you for joining us today, and Tanya, who's not part of the final Q&A, and folks on the session who are familiar with Medicaid match funding. If you're already leveraging that for your APCD, fantastic. If you're not, it's worth looking into, and it's worth thinking creatively too, because I think we're used to thinking about Medicaid match supporting APCD, but Tanya's points about integrated data systems, harmonization across data sources, combining data, making it usable in a single platform. These are things that the federal government has shown a willingness to fund and is an important source of support for the project in Delaware, as well as the ecosystem in Rhode Island. Thank you again, Rebecca and Alana. Thank you all for joining. And if you have questions, we'll be happy to take them and respond to them now that the session is concluded.